Hello, my name is McKenna Little, and I am doing my presentation on a feeding plan for infants with cleft lip and cleft palates. So it's important for mothers to have an understanding on what cleft lip and cleft palate actually is before they're able to have an understanding of the feeding provocations for it. So, cleft lip and cleft palate are two separate things, but often go hand in hand with each other. In a 2022 article for PTC Kids called Craniofacial Disorders, they explain that cleft lip is the separation of one or two sides of the lip. And so you can see on the left, there's a unilateral cleft lip and there's bilateral cleft lip, and it is shown on the picture here. The cleft palate is an opening in the roof of the mouth, and so that's on the bottom of these pictures here. These facial structures are the result of a baby's facial structures not closing completely while they are still in the womb. And the septation includes the bones of the upper jaw and or gum and dysformalities in the lip and the muscles around the lip and nose. The same article from PTC Kids shared that cleft lip is one of the most common craniofacial disorders. According to the CDC, 1 in every 1,600 babies are born with cleft palate and cleft lip every year. And this shows that it is much more common than people realize, but it's typically not something parents are prepared for. It can create difficulties feeding, and it's important to be aware of these challenges and how to go about them to adapt to a baby's needs. Typically, babies have surgery around 10 to 12 months old to close the gaps, but they have to be a certain weight and healthy enough beforehand, which means essential breastfeeding of the newborn up until surgery is crucial. So due to the misstructure in the baby's face, many feeding difficulties can arise. The Royal Children's Hospital in Melbourne wrote an article called Cleft Lip and Palate Infant Feeding, in which they explained that when feeding a typical baby, these babies need to position their lips and tongues around the nipple and create a suction and compression during the sucking. And sucking is more difficult when a baby is born with a cleft palate or a cleft lip because the slit in their facial structure allows for airflow, which this interferes with the needed suction. And so feeding with a cleft palate is much harder because the babies typically can't generate suction during the feeding due to the air leaking from the mouth through the cleft into their nose. And so that's one of the main difficulties when feeding babies with cleft lip or cleft palate. This can also lead to feeding taking a longer time because there isn't constant flow due to the lack of suction. And another difficulty is the fact that the baby might not get enough milk, which can lead to malnutrition. When feeding, the babies are putting in a lot of work to try and suck, which is very tiring to them. And so they may take in a lot of air rather than milk. And for example, when their stomachs will get filled with half milk and half air. And so then the mother would think that if the baby falls asleep because the baby is tired from trying to eat, and then the mother can think that their baby is actually full when really it's just like half and half. And so this can lead to malnutrition and the baby not getting the correct amount of nutrients and full feedings. Another issue is the amount of stress that it can cause on the mother because there's just so much that goes in with feeding a baby with cleft lip and cleft palate. And so a 2020 peer article written by Madhoun and Sarand and a few more authors titled Breast Milk Feeding Practices and Barriers shared a study that was done where they compared mothers of babies with cleft lip or cleft palate to mothers that have babies without craniofacial disorders. And it showed that there was a high increase in distress, in which this ultimately showed a negative impact on the feeding experience and overall health of the baby. Despite the difficulties previously mentioned, there are things a mother can do that will make a huge positive impact on feeding a child with cleft lip and or cleft palate. The first tip involves the placement of the mother's breast when feeding. If the baby has a unilateral cleft lip, the nipple should be placed directed towards the side of the mouth that doesn't have a slit. The mother should simultaneously squeeze their breast to help the suction problem, but the mother needs to make sure that it's an appropriate flow for the baby to swallow. And you kind of just have to read your baby and see if they're starting to choke a little bit, or if it's too much for them and it's coming out of their mouth, then reduce the amount of squeezing. But this will just help the baby get that suction that they're not getting on their own. If breastfeeding is too difficult, then the mother can invest in bottles with wide-based teats or specific cleft bottles that can be recommended from a doctor. There's many out there, and it's all about your baby's preference and what they're able to adapt to the best. So it's kind of just a trial and error type situation, and communication with your doctor is important on that to see what is best for your baby. Another thing a mother can do to have better feeding is to have the correct position of the baby during the feeding. And so the mother should hold the baby in a more upright position than a typical baby, so that the milk goes into the stomach instead of through the nose and directly to the lungs. And so you don't want a 90-degree angle, because that can cause them to not be able to swallow it as well, but you also don't want them to lay back as much as a typical baby, because this can cause the milk to go up their nose, since there is more of a open tunnel for that. And then the next thing that you can do is burp your baby more often than you would for a typical baby. And so babies with cleft lips or palates take in a lot more air than typical babies, so they need to be burped like way more often. And a good starting point is to burp them every half ounce to every full ounce. And this will just help get rid of the extra air that they take in that a baby without cleft lips or cleft palates wouldn't take in. And a baby's weight can show how much food they are intaking, and so a mother can also weigh the baby regularly and keep track of the weights to have a clear indicator if they're getting enough nutrients. This is also great to have to show the doctor, which brings me to the next point of having regular doctor's visits. The peer-reviewed article that I previously mentioned also explained that providers with expertise in feeding and nutritional management should be a part of a team surrounding the baby, and this will help them to perform ongoing assessments of the feeding treatments. And clear communication with the doctor is crucial in being able to fully understand the baby's health and needs. And although there are many difficulties with feeding a baby with cleft lip and cleft palate, there are so many ways to adapt to your baby and to truly still take care of it and be able to get their weight and their overall health up to a point where they can receive surgery later on down the road.